Hello. Your surgeon believes that you would benefit from an operation called a transurethral resection of prostate, or TURP. This is a procedure performed on men who have problems with their waterworks because of an enlarged prostate. This video will explain why you need the operation and what it involves. The prostate is a gland which is only found in men. It sits just below the bladder and produces nutrients for the sperm and contributes to the semen. The prostate gland is about the size of a walnut, but can get bigger with age. This is a condition called benign prostate hyperplasia, or BPH. The urethra is the tube that carries urine out of the bladder and travels through the prostate. An enlarged prostate compresses the urethra, causing a more frequent need to go to the toilet, which is more noticeable at night, difficulty passing urine, and occasionally it can stop the flow of urine altogether, which is called retention of urine. However, some men may have no symptoms despite having an enlarged prostate. A transurethral resection of prostate is an operation which removes some of the prostate. A small tube is passed up through the penis, and the inside of the prostate is scooped away using a heated wire loop. This relieves the pressure on the urethra, making it easier to pass urine. There are several alternatives to having a TURP, although these may not necessarily be suitable in your case. Your consultant will have discussed these options with you. Continued observation, to wait and see if your symptoms get any worse. Medications to relax the muscle of the prostate, as well as prostate shrinking tablets. Laser prostate surgery, which is a very similar operation to a TURP, except that a laser is used instead of an electric current. This is not available at all hospitals. A permanent catheter for men who do not want or are not suitable for a TURP. Urolift, which is a new treatment where the urethra is widened without cutting or removing the prostate. All procedures have risks, and it's important that you understand these so that you can make an informed choice about whether you wish to go ahead with the operation. Mild burning and bleeding when passing urine, and needing to go to the toilet more often for a short period of time after the operation. Retrograde ejaculation. On ejaculation, the semen goes up into your bladder instead of out through the penis. This makes the urine cloudy when you pass urine after sex. It is not harmful. 3/4 of men will have this after a TURP. It is a long-term effect, and your fertility may be affected. However, you should not rely on this as a form of contraception. The treatment may not stop all of the symptoms. In some men, the bladder muscle may be weak or overactive, which causes ongoing symptoms. Poor erections. The heat of the wire probe used in the operation can damage the nerves that control erections. 1 in 10 men may experience problems having an erection after a TURP. A urine infection. Infections cause burning on passing urine, smelly urine, or a fever. They can usually be treated with antibiotics, so see your GP if you develop any symptoms. Bleeding after the operation. This may need a blood transfusion or further treatment in theatre. Bleeding happens in about 3 out of 100 patients. Injury to the urethra, causing delayed scar formation. Scarring can cause problems with the flow of urine as the urethra narrows over time. This happens in about 2 in 100 patients. The need for further surgery in the future. If your prostate grows again, about 7 or 8 out of every 100 men need another operation within 4 years. Finding cancer in the prostate gland. This may need further treatment. Inability to pass urine despite the operation. A long-term tube to drain urine, known as a catheter, may be required. Alternatively, you can learn to catheterize yourself. Loss of bladder control, called incontinence. This may be temporary or permanent and occurs in about 3 in 100 patients. Heart failure, feeling sick and confusion. This is because of the fluids used during the operation getting into your bloodstream. Bladder perforation. This is very rare and may require a temporary urinary catheter or a bladder operation. Infection with a hospital bug, such as MRSA or Clostridium difficile. This is more common in people who've had a long stay in hospital or who have been into hospital many times before. A clot in your leg known as a deep vein thrombosis. You can reduce the risk of developing clots by wearing stockings as advised by the team. You may also be given some blood-thinning injections. It's important to weigh up the risks and benefits associated with having a transurethral resection of prostate. Please speak to your urology doctor, specialist nurse or GP if you have any questions.